And still about antenatal, when you come to antenatal early, or when you attend your antenatal visits as scheduled by your doctor, this one will prevent you from scenarios of delivering from home, because you will be ready. You will know at least in this month I may have a baby. So at least you're ready. You don't go to areas far away from the health centers. At least you're in an area that is closer to the hospital, in that you're able to reach the hospital earlier before anything happens, and also to prevent giving birth from home. Because we know when we give birth from home, it comes with a lot of complications. Here you may even have we can have obstruction, in that you don't have a skilled medical personnel to attend to you. They can't know early that you won't be able to push this baby. They can't know early that you're unable to deliver the baby in time. And also there are some illnesses that we still want to prevent when we deliver from home. The cases of sepsis, because we are using things that are not sterile. Most times, blood harbors a lot of germs, I would say. It harbors a lot of germs that can penetrate through it. This one can either affect the mother or baby. Can find that the mother can come with tetanus, because either they may have used blades that are not clean to cut our baby's cord. This one will impose both harm to the baby and to the mother. So it's very important to come to the hospital where we have skilled personnel to take care of you. And in case you're home and you're unable to push this baby so well, because you're just alone, you have no one around that is skilled, like a medical doctor or a medical personnel, the midwives, they are not around. So you're unable to know when is the right time I should go for a cesarean section, or this baby, maybe we need some extra effort for the mother to push. But if you're in a health center where we have these medical professionals, they are able to detect these things earlier, and they can help you before the condition escalates something worse. So it's important when you come to antenatal, we go ahead to weigh all these risks and benefits, what we should do as the medical personnel, what we should do for this mother, depending on what the mother is presenting with. So all in all, it's important to attend antenatal, and we should know that the right time to attend antenatal is the moment you know that you're pregnant. It's important. The moment most of the times, most of us have self-diagnosis. You go ahead, you get a pregnancy strip, and you come and test, and that is all. But you have to go to the hospital and we confirm. Is it true? Because we have a lot of things that can give us a positive pregnancy test. But until you come to the hospital, that is when you're able to know that you're carrying a normal pregnancy, when the medical professionals examine you. And you should always attend your antenatal according to your scheduled time. If they give you an appointment to come, at least try to make it a habit to come for your antenatal visit. Take your medication in time. Take the doctor's advice. Let's keep a good personal hygiene, and let's mind about the foods that we eat, because we have a lot of foods out there in our homes that are so important and we neglect. We don't take them every day. But when you're pregnant, when you come to the doctors, they will advise you about those foodstuffs that you need to eat to help you in the growth of your baby so well, and even you as a mother. Most of us have different blood types. Some of them can have the positive blood types, others can have the negative blood types. So it's important to come to the hospital such that we are able to know your blood type. In that, you may carry your first baby very well to term. You deliver the baby, but during the subsequent pregnancies that can follow, it's very important to see that we are having the blood type that will be fit to enable the mother to carry this baby up to term. So when you come to the hospital and we screen you and we find that your blood blood type is slightly different from what we would expect. It's slightly different from the father's blood type. Most times we give you the medication that will prevent you from having another abortion or miscarriage, such that you're able to carry this baby up to the desired time that needs to be carried. And even when the baby is delivered, we still give you the medicine that will prevent you from having a miscarriage earlier, before the time is expected to receive another dose during this pregnancy. So it's important to still come for antenatal. That is a very important part of our antenatal visits, because most times we can have our baby, we can have our firstborns delivered so well, but then we have continuous miscarriages, and someone is wondering, why am I having these continuous miscarriages? So it's important to come to the hospital to find out why are we having these continuous miscarriages. That too can also be another cause of these continuous miscarriages, on top of the infections that the mother may be having at that moment. And still during antenatal visits, there are some form of exercises that are really important during pregnancy, like a walk, not just sitting redundant at home, because it will help you with the blood supply, your movement of blood into your body, prevent you from some illnesses like the diabetes. This is something that we all know is important, the exercises, before even we are pregnant. But during pregnancy, we try to reinforce it. Here we're not talking about hitting the gym, but doing simpler exercises and work, like an evening walk, doing things here and there, such that you're not just seated at home redundant like that because you're pregnant. It's important to have some little bit of exercises. Some women ask, is it important to have sex when pregnant? It's okay. It is safe to have sex during pregnancy, depending on the condition of the mother. If you're entirely okay, without any other complications, like for the cases of bleeding or spotting during pregnancy, it's okay to have sex. And it is safe and healthy for the baby and for the mother, unless this pregnancy is complicated and you have some diseases that the doctor can advise you on, and they advise you either to abstain from sex, but it won't be for quite a long period of time, to abstain from sex for some period of time. And this one may also involve abstaining from vigorous exercises that can hinder the development of the baby or can put the baby at risk, depending on the condition that the doctor will find you with. So sex is safe during pregnancy until the pregnancy is complicated and you've been advised to restrict. All this month has been dedicated to talk about antenatal. Anyone who has any questions of any kind about antenatal care, anything concerning pregnancy, feel free to reach us on our social media platform at Health Touch Uganda. As I said, antenatal is a mandate to every pregnant mother, and it's important the moment you find out you're pregnant to go to the hospital immediately without any delay, because it's important for both the mother and the baby. It has been Dr. Nandagala Caroline from Health Touch Uganda. Let's keep in touch on our different social media platforms. Thank you.